The number one issue from day one has been testing. When we started fighting the coronavirus here in the city, we said we needed the federal help with testing. It never came. We have scoured the world looking for test kits on the open market. It's been extraordinarily frustrating. We've had so many good people searching everywhere just to buy the test kits to get a reliable supply. It has not been possible. So over months now, the place we turned to for help, Washington, D.C., we never got a straight answer. We never got a consistent approach. And we wondered when would the day come that we could actually get the test kits we need so we could start on that road that I talked about a few days ago, from this widespread transmission of the coronavirus to low-level transmission and eventually no transmission. To get there, you must have testing in large quantities. And we knew that as recently as yesterday, we did not know when and where we would get those test kits. Now, we've had one breakthrough on the open market and then another breakthrough right here in New York City, and I'm so excited to tell you about this. Our friends from Carmel, Indiana, I talked about them a few days ago. They donated test kits. A biotech firm there donated test kits to us. But now they have confirmed they can produce them regularly for New York City. So on top of their donation of 50,000 kits, which we're so appreciative for, ARIA Diagnostics, Carmel, Indiana, is now going to be producing test kits for New York City. We will be purchasing them starting Monday, April 20th. It's coming Monday. We'll be purchasing 50,000 full test kits per week from ARIA Diagnostics. I'm sure New Yorkers wouldn't have thought that the cavalry would come from Carmel, Indiana, but it has. This is going to be a big piece of the solution going forward. We're going to get a whole lot more, I want to be clear, because to really get to that point where there's no more transmission, we're going to need a huge number of test kits. But even being able to know we can rely on 50,000 a week from a supplier that we believe in, that's going to be a major, major step forward for this city. I want to thank Mayor Jim Brainerd of Carmel, Indiana, who I've gotten to know over the last few years very well at the U.S. Conference of Mayors. He and I are on the leadership of that body, and he has been an extraordinary friend and ally and really stepped up for New York City. So Mayor Brainerd, again, thank you. Thank you to everyone in Carmel. Thank you to ARIA Diagnostics. This is a big step. So that's 50,000 per week, but we're going to need a lot more. And remember, a test kit, and I talked about this a few days ago. I used the analogy of a cup of coffee with cream and sugar. You need the coffee beans, you need the water, you need the cream, you need the sugar, you need the coffee mug. Putting together the full test kit takes three basic components: the nasal swab, the liquid solution, that's what you keep the sample in, it's called the viral transport medium, and a tube with a screw top that keeps the sample secure and sanitary. You need all three of those things to perform a test for the coronavirus. And then, of course, you have to get that test to a lab that then processes it. So we're talking right now about just collecting the test itself from an individual. A whole other part of the equation is continuing to increase the capacity in labs to process these tests and give us the answer person by person, positive or negative. Again, we're going to have to do that on a mass scale going forward. But to get these three parts together so you can collect a test from someone, well, you can't get to first base unless you have the actual test that you can collect from people. So needing those three pieces was crucial. Again, our efforts to get them consistently from Washington, D.C., no result. Our efforts to get them from the open market never could get a reliable partner until today with ARIA Diagnostics. So as we went through these last days and saw New York City companies stepping up, our local government, particularly our Economic Development Corporation, bringing together partners from the private sector, figuring out how we could do surgical gowns, figuring out how we could do face shields, starting to figure out other equipment that we need to build. And we'll have announcements on that too, constantly figuring out new ways to support our hospitals and get them the supplies and equipment they need. More and more, what's happened is the members of our team here at City Hall, Economic Development Corporation, and companies, and even universities now, all talking about what can we produce here, how can we do it more and more, how can we do things that have never been done in New York City. So just a few days ago, people started saying, wait a minute, if we can make all these other things, could we say, no matter what's going on in the international market, no matter what's going on in Washington, could we actually make the test kits here? There's nothing like it in New York City being made right now, nothing even close, but could we make them here? If we just threw in the kitchen sink and tried all the ingenuity that exists in this city. At first, of course, we didn't know what the answer would be. We had to pull together a lot of smart people to figure out, could it be done? Could it be done quickly enough? Could it be done in the quantities that we needed? And we thought about what New Yorkers are facing. We thought about this crisis and what we have to get through. We said, well, if people can make them around the world, why not us? Why couldn't we make them, even if we've never done it before? Companies all over the world could make some of these components. Why couldn't the most innovative city on earth figure out a way? So I'm here to announce to you that we have found a way. And starting in a few weeks, we will be producing here in New York City 50,000 test kits per week with components put together right here with companies, universities, New York City workers right here, building a brand new supply chain to feed this industry that will now develop in New York City. 50,000 tests per week to begin. And if we can go farther, we're going to build it up rapidly. It means commercial labs and academic institutions in this city working together to produce that liquid solution the right way. It means local manufacturers and 3D printers coming together to make the testing swabs and the tubes. Something as simple as those testing swabs, the entire international market has been struggling because those swabs have been less and less available. In fact, a lot of them are made in places that were deep in the middle of the COVID crisis themselves. So the whole international supply was disrupted. But now, through the ingenuity of New York City producers, figured a way to make them right here. Production will begin in a few weeks, at the beginning of May. 50,000 a week to begin. Add that to the 50,000 a week from ARIA Diagnostics. We'll have 100,000 full test kits per week that New York City can rely on, 400,000 per month, and that's just the beginning. So we will have to take that new capacity, ensure that there are labs that can handle all those tests and get us results in real time. And remember, we're going to need the personnel to administer the tests. We're going to need the PPEs to protect the personnel who administer the tests. There are a lot of pieces to this equation, and all the while continuing as a city to make the progress we're making through social distancing and shelter in place. So even while we're building out this brand new capacity, and it's going to help us to the next stage, we will not let our foot off the gas. We will not relent in the successful strategies that are now opening the door to getting out of this horrible crisis.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.